I just wanted to, gosh, thank you for the experience, the wonderful experience you've given me with my surgery. I had, as you know, some back problems, and the torsoplasty that you've done has actually alleviated some of that.
Good.
But more than anything, the butt implants, as you well know, I've called you and I've called your office, and I have to say that you guys have been fabulous. I appreciate the day I called you at 2 o'clock in the morning and you called me back, and you weren't upset or anything. I was crying and you just calmed me down, and every time I've been to your office, you guys have been really, really great, and I just really wanted to thank you for that.
My pleasure. Well, thank you very much. You've gone through a lot with the bariatric surgery, and this is sort of phase 2, as I call it, the plastic surgery after bariatric surgery. And I know it's not easy going through the weight loss surgery and then the secondary plastic surgery, but once you get sort of through the plastic surgery, then you can look back and say, I hope, yes, this has been worth it, and yes, it has been a good experience. Not easy, but a worthwhile experience.
Yes, and I do have to say that it's not a vanity.
Mm-hmm.
And as I told you in your office, for me, it's more about looking normal.
Mm-hmm.
I can look in the mirror,
mm-hmm.
and I can see myself looking what is considered normal and or average, and I really appreciate that.
I totally understand exactly what you're talking about. In my practice, which is plastic surgery after weight loss, for me it's about getting patients looking back to normal. You've had weight gain, then weight loss, and now there's sort of that phase 2 to get you back looking normal. So yes, that's what my practice is dedicated towards.
And I appreciate it. And I did do the research.
Good.
And I do have to say that your practice is weight loss surgery patients, and I am so glad I found you. Thank you.
Well, thank you for coming, and I always urge all patients everywhere to do careful research on their plastic surgeons, making sure they're board certified plastic surgeons, and making sure that they are plastic surgeons who specialize in just weight loss surgery. Just weight loss surgery.
Can you also explain to us, number one, if you're board certified and why it is important to go to a board certified plastic surgeon?
Sure. I think it's paramount whenever you're seeking out a medical procedure that you go to somebody that has the right training. If you're seeking bariatric surgery, you should go to a bariatric specialist, typically a general surgeon. I think if you're seeking plastic surgery, you need to go to a board-certified plastic surgeon who specializes in plastic surgery after weight loss or after bariatric surgery. So I'm certified by the American Board of Plastic Surgery, and then I've further subspecialized my practice into plastic surgery just after massive weight loss.
Can you also give us a tip of how to select a plastic surgeon when we're ready for that?
Sure. Again, I believe the most important thing is to make sure your plastic surgeon is certified by the American Board of Plastic Surgery. And the best way to sort of find out who is certified and who is not certified is go on the internet and look up www.plasticsurgery.org. So PLASTICSURGERY.org. And that's the main membership in the American Board of Plastic Surgery. So everybody listed on that site is board certified by the American Board of Plastic Surgery. In the state of California, any surgeon can call themselves a cosmetic surgeon. So the press and the internet and sometimes the TV commercials and the programs that you see, yes, they may be a cosmetic surgeon, but as to their board certification, it could be in almost anything. So, number one, make sure they're board certified in plastic surgery. Also check out that website, www.plasticsurgery.org.
with many post-bariatric patients, they have so many different nutritional needs, taking their vitamins and iron and so forth. Do you have a registered dietitian or somebody that works with these patients in the office?
Sure. I became very aware of the nutritional needs of weight loss patients very quickly in my practice. I do very large procedures, 10, 12 hours long, taking off 60, 70 pounds of skin at certain times, and I became very quickly aware of the nutritional requirements of these gastric bypass patients and weight loss patients. One of the problems with the gastric bypass patients is just because you're changing the anatomy of the stomach and other intestinal parts, that subsequently leads to malabsorptive problems and malnutrition problems. So I found it very critical to have a registered dietitian in my office to assess my patients preoperatively to make sure their nutritional needs are met, and to follow them postoperatively to make sure their healing is correct and they're taking enough protein in. So I have a registered dietitian in my office full-time working with my patients. Two main offices that I have, one in Beverly Hills and the other one is in Hawaiian Gardens, which is on the perimeter of Orange County, and I have privileges at about 7 different hospitals. I'm the chief of reconstructive plastic surgery at Century City Doctors Hospital. I also have privileges at Olympia Hospital, Cedars-Sinai Hospital, and Tri-City Hospital. One of the best resources of information about weight loss and patients going through their journey of weight loss is obesityhelp.com, and my personalized website is body, B-O-D-Y, next word by, B-Y, Katzen, K-A-T-Z-E-N.com. So just remember obesityhelp.com, and then also remember bodybykatzen.com. My practice is focused on patients who have had weight loss. Typically, my patients have lost at least 100 pounds or more. Most of my patients have had gastric bypass or a significant dieting exercise to have lost 100, sometimes even over 600 to 700 pounds. Just depends on the type of patient. And my patients, because of their massive weight loss, develop a lot of excess skin and some residual fat left over from that massive weight loss. So typically they need touch-ups in those areas.
And what percentage of your practice would you say is dedicated to post-bariatric patients?
My practice is dedicated to weight loss patients, and approximately 99% of my patients have lost at least 100 pounds or more. I have had 2 patients who used to weigh over 1,000 pounds, so anything under 1,000 pounds I've seen in my practice.
And does your office accept any medical insurance?
We do a significant amount of insurance work. Approximately 80% of our seeking for insurance approval gets approved. I go out of my way within the office to take pictures, provide medical documentation, talk to other doctors, including dermatologists, internists, chiropractors, neurosurgeons, to get insurance approval. And the letter that I send out is about 14 to 15 pages to seek insurance approval. So I believe that most of these procedures should be covered by insurance. It just takes extra effort on our office part to get it approved by the insurance.
When would you recommend for a post-bariatric patient to start looking into plastic surgery?
Very good question. There are 2 types of weight loss patients. There are the patients who have a traditional, if you will, Roux-en-Y gastric bypass, and there are patients who have a lap band. The patient that has a Roux-en-Y gastric bypass will typically lose their weight between about 8 to 10 months out from their Roux-en-Y procedure. Then I like their weight to be stable for about 2 or 3 months, being a constant weight where the weight doesn't fluctuate, and then they can think about plastic surgery. The lap band patients, they lose their weight over a gradual period of time, typically about 20 to 22 months out, and then I like their weight to plateau for about 3 to 4 months before they think about plastic surgery. So if one is about to have a Roux-en-Y surgery, you can start thinking about plastic surgery about a year out from your procedure. With lap band, it's about 2 years out from your initial lap band. But those are just generalizations. The take-home message, though, is after your gastric procedure, you need to have a constant weight of about 3 months' time before you even think about plastic surgery.
And what kind of services do you offer in the office? What are the typical procedures you do for post-bariatric patients?
Typical procedures that we see after massive weight loss are tummy tucks, If you have a lot of excess skin and fat in the hip region and even in the buttock region and the buttock sags, I turn that tummy tuck into what I call a power lift, which goes all the way 360 degrees around the body, resulting in what we call a circumferential. That means all the way around the edge body lift. I also do a significant amount of leg lifts, which are basically incisions in the leg to lift the inner thigh up. Other procedures that I do would be breast lifts, breast reductions, and sometimes breast augmentations and lifts in females. And in the males, typically we do breast reductions. The other procedure that we do a lot are arm lifts, getting excess skin and the fat in the arms off. And we also do a significant amount of face lifts and neck lifts to get rid of excess skin and fat in the neck.
Dr. Katzen, how long have you been doing this, specializing in post-bariatric patients?
Sure. I've specialized in plastic surgery after weight loss for the past 8 years. I've honed down a lot of skills that are very unique in my practice, and we have come up with a very traditional way that works very well, which is safe to do, and I stage these procedures to get you the best possible outcome.
Hi there, my name is Dr. Andre Aboulian. I have Barbara on my right side, and I have Amy on my left side. Amy just had body lift 3 weeks ago with liposectioning, and Barbara on my right has had a body lift with liposectioning. She's had her arms done, and she's had her sides, the size of the breast done. I'm going to let both of them say a couple of words about their experiences and how they went about losing their weight and how they came to be plastic surgery patients.
Okay, I originally had a gastric stapling 18 years ago that was very unsuccessful, and over the last, about 3 years ago, developed an incisional hernia, and that sort of motivated me to take care of the hernia and also maybe investigate bariatric surgery at the same time, and came upon a surgeon that was able to do a gastric bypass on me. And going to their support groups, Dr. Aboulian spoke one time, and he said he does his vertical incision and pulls, and I said to my husband when he was sitting there with me at the group, "That's for me," I said, because I had this terrible keloid scar in the middle, and his procedure sounded just perfectly fit for me, and I went ahead and did it. And then like 3 weeks later, did my arms. I had lost 90 pounds, and when I went to see Dr. Aboulian, I said, I'm coming to see you to find out how much more I need to lose before you would consider doing me. And he said, "You're fine as it is. It's not going to make a big difference if you lose another 10 pounds, and I can do you now."
What we recommended for Barbara is, instead of torturing herself and losing another 10 or 20 pounds, I told her that we can remove that skin and she'll be at the weight she likes to be. But to me, the more important thing with all bariatric patients is that they have essentially done away with their bad habits, which is clean up their eating habit, have some sort of an exercise routine or regimen that they follow so that they're healthier, their heart is healthy. And I want at least a year to pass from their bypass surgery, whether it's gastric bypass or lap band surgery, or if they've done it completely on their own without any surgery. And after surgery, she can tell you how happy and how her recovery went.
I can tell you how happy my husband is too. He's very supportive, and he has been with me the whole way, and I'm very lucky that I have such a strong support system. My first surgery on January the 10th, which was a body lift, and I had my arms done on February 2nd because I figured if I was down for the one, I might as well be down for the second one, and then we were off to China and Tibet on April 15th. So it was a pretty rapid recovery.
What I tell patients is to give me 2 weeks for their recovery, meaning they get their surgery done, they're out of bed within 48 hours, up and walking. I want them to stay put for a good 2 weeks, meaning I want them walking around, moving around, but I don't want them to do much. And if they have a desk job, they can go back to their work within 2 weeks. As far as pain is concerned, which is the thing that everybody is concerned about, I tell them it doesn't really hurt. And Barbara may have forgotten since her surgery was in January, but Amy here is has had her surgery about 2.5, 3 weeks ago, so she can tell you more in detail about how her pain was. But it's a procedure that doesn't really hurt, but what your patients feel is pressure. When they move around, they feel like, there's pressure, and they feel like they're going to pop into two. They feel like their stitches are going to come undone. So I tell them that basically, even after 2 weeks when they go to work, to still take it easy. No exercise, no lifting for a good 4 to 6 weeks. And the recovery is pretty much very easy as far as from what I see with the patients going through. The major thing that they all experience is, when am I going to exercise, when am I going to move? And their biggest fear is, am I going to gain my weight if I'm just laying around doing not much? And I tell them, no, it's not going to happen. And Amy is going to tell her side of the story and how far she is from her surgery.
Yes, I lost weight through diet and exercise, and I was up to a weight of 260 pounds. And my weight has yo-yoed up and down since I was a teenager, so probably one too many times up and down of like 70 pounds at least, and the skin just wouldn't recover. And I had got down to my goal weight last year, and I just could tell that my skin, I was doing a lot of exercise every day, weight training, and it just was not coming back. And so I do watch a lot of the TV programs with the Extreme Makeover and the Biggest Loser, and I got some names of some physicians that I saw, and I looked and I went in for consultations, and I just felt the most comfortable with Dr. Boulian, and his just attention to detail, and the before and after pictures were just so much superior. So I just had a great comfort level there, and so we decided that the summer was a good time to do it. I had had my weight off for about a year, so I felt like my lifestyle changes were permanent, and I can live with those, so there will be no more yo-yoing back and forth.
How long are you from your surgery?
Almost, 3 weeks. It was 3 weeks yesterday, actually.
And how was the pain?
The pain is minimal. I've been surprised at how little it is. You do feel the pressure around you, but it's not bad. It's not a painful pressure. And it just reminds you how far you've come in your journey.
All of her sutures will come out next week, and she still has a tape on her scar. And I keep that tape on for a good 2 months. Are you taking any painkillers still?
No.
Okay.
I took them for about 3 days, and then I take a Tylenol here and there, and that would be
And that's the experience most patients have. They'll take painkillers maybe 3 to 7 days, and after that they don't even feel it. They need to. So I don't use any pain pumps. I get them up. After surgery, they go to what's called an overnight care facility where they stay there 2 days, no more than 3 days. I don't want them to stay there more than 3 days because I want them to get up, move around, and I want them to feel like they're okay. It's not that bad, and that's exactly what happens. After 2 or 3 days, they go home, and I see them 1 week, 2 weeks, a month, 2 months, and 6 months after surgery.
I chose Dr. Boulian because I did consult with about 3 or 4 other doctors, and it just came down to my comfort level. And when he was talking to me, I could tell he, really cared, and he really wanted to know that the weight was off and it wasn't going to come back on again, and he wasn't going to do it just for the sake of doing it. That that I had made some permanent changes, which it's important to me as well, and the detail of his pictures, the before and after, the sitting down poses, which I never saw in anybody else's. So it was just, it was a no-brainer. I had to choose him because he was just the best one by far.
When choosing a plastic surgeon, I think the most important thing, in addition to, as a patient, you liking to your physician, is you have to look at before and after. You have to look at photos. If you're looking for results, when you go see a plastic surgeon, you want results. You should not care how nice they are. You should not care about everything else. Those are important, but you're looking for results. And the way you assess how good of a surgeon this person is you're going to work with, or what kind of results you're going to get, is you have to look at before and after photos, and you have to look at many before and after photos. And when you're looking at before and after photos, they have to show you at least 6 views from each patient, standing up, and the pictures have to be from under the breast to all the way to the knee, so you can get a good feel for the whole body. You're not just looking at the tummy from a close-up view. And then they have to show the front, the quarter turn, profile views, back views, sitting views. These are all things that you have to look at in order to get the best sort of assessment, if you will. And after you've looked at the photos, you need to decide if the scars are good. You need to decide if the scars are in the right places, the scars aren't too high, too low, too wide. And also, after that, you need to speak to some patients who have had the surgery done themselves. And what I tell everyone, even when they come to my office, they'll say, oh, I know you've done so and so, and I really want to do it. I say, you know, it's good that you have a good referral, but I still want you to talk to patients. And I give them names of people who've had the surgery done months ago, who kind of are completely healed and have forgotten exactly what it was like to go through the surgery, and maybe names of 1 or 2 people who just recently, like Amy, had the surgery, who can tell you more in detail what their recovery is like. So that way they'll get a better understanding of what's ahead of them.